Our topic today is client consultation. So today I'm going to go over client history and assessment using the SOAP acronym. So SOAP stands for collection of subjective data. So subjective is the S in SOAP. O represents the collection of objective data. A is the assessment, which is the interpretation of the S and the O. And then we use this to develop the plan of action. So subjective data, by definition, is that information that's based on the person and their individual beliefs. So this is where we talk about the client, their history, their feelings, and what we gather when we're collecting subjective data is the items that are not necessarily facts. So they're not measurable, but they're important because in our client history, we want to first establish a rapport. So actually getting to know the client, understanding them a bit better and knowing their barriers or any limitations that they might have to physical activity. Also understanding their access to any facilities, knowing their priorities and what motivates them, because that's going to help influence potentially the action plan you create. And then any injuries or chronic conditions they may have and what to do if they do actually tell you that they have injuries and how to therefore create a program for them based on that. Objective data is the information that you're going to be collecting that is based on facts. So these data do not include the person's feelings or the beliefs that they hold. And we can collect objective data through surveys, which you'll see in your client trainer packages, as well as through fitness assessments, where we actually measure the person's performance or taking their height or their weight in order to find out BMI. These are all objective data. These are quantifiable, and these are facts in essence. From there, we're going to move on to the assessment, which is your professional interpretation of the subjective and the collective data that you have just gathered from your client. And you evaluate that to therefore create a plan of action on how you're going to help this person create and accomplish goals that they may have. So when we are doing this, we're going to follow the CSEP 5 A's, which is ask, assess, advise, agree, and then assist or arrange. These are the 5 A's that we use when we are working with our clients. So step one, you first need to get to know your client. So this is going to happen in your pre-meeting first, where you're going to send them their physical activity readiness screening questionnaires. And the first one that we send is the Get Active questionnaire. It's also known as the GAC. We also may send them the Abilities for Active Living questionnaire. If they have a chronic condition, we might have to have a physician sign off. So in that case, we would need the physician physical activity readiness clearance for this person. Or if they're pregnant, we might ask them to fill out the PARMEDX for pregnancy. And all these tools, again, are pre-screening, and it basically allows you as the trainer to know whether or not this person is going to need additional screening from a doctor or a physician in order to participate in exercise, because you wouldn't want them to have some sort of adverse event like a heart attack, or, if they're a diabetic and they don't check their blood pressure could drop. You want to be aware of these things before you start to work with the person. So this is what the Get Active questionnaire looks like. It's your pre-screening for physical activity. It's created by CSEP, and it has recently been updated as an evidence-based screening tool that you can use with all your clients. And it also has replaced the previous versions. So you might have heard about the PAR-Q or the PAR-Q Plus. And those are former versions of this questionnaire. And the reason they've been eliminated and removed, and we've now got the Get Active questionnaire to replace them, is because the old versions had a lot of false positives, which meant that people were saying yes to answers that really they could respond with a no to. And so that's why it has been replaced now with the Get Active questionnaire. It's a self-administered questionnaire, so the client can do this on their own time, or you can go through it with them. And there's the reference guide to indicate medical clearance, whether it's needed to get that sign off from a physician or not. So if they're brand new to exercise, if they answer yes to any of the screening questions, we would definitely want the physician to sign off, because if anything were to happen to the client in your care, you are liable. So we want to make sure that we've communicated that we've had any chronic conditions or exercise considerations sent us from the doctor. From your initial contact, you're going to then set up a first meeting with your client. And this is where you're going to continue to establish a rapport and gather more information about their client in order to help determine their goals, their physical activity experience, and their physical activity preferences, what they actually like to do. So you'll receive these questionnaires through your client and trainer packages from CSEP, where you'll have a welcome letter and you'll have the informed consent, which you want your client to sign off on. Then you also have your client interview notes and the client information sheets that you can use as a reference guide when you're working together. If someone has stated that they have an injury, either current or prior, we definitely need to make note of this. And some things we need to consider are the questions I provided here. So where is the injury? Because we want to find that out, because if we're going to be prescribing exercise, we need to know what movements provoke the injury or might cause the person to hesitate or guard that part of their body. As well, what was the mechanism of injury? So how did they injure themselves? Did they go to rehab? Have they worked with a physical therapist, or did they just kind of go back to work and they're just basically just hoping that it doesn't get injured again? Was this injury last week? Was it last year? Was it 10 years ago? Because whether it happened a week ago or a month ago or a year ago, we want to know that, because we're still going to likely see problems from it arise as people are participating in physical activity. And also thinking about, what anatomical structures are involved with the injury, because you might see changes to the anatomy around that injury, or you might see changes or differences with how that person moves around the affected injury. And that might be different from one side of their body versus the other side. So comparing the injured side to the uninjured side, how have they been managing this injury? And then how have they had to change their activity levels, or have they had to change any training, or how they've commuted to and from work? Is there any changes in the tissue around the injury, and are they still experiencing that pain to date? Next, we're going to assess the client, and we want to do this so that we can determine the individual's major components of fitness and really collect those baseline values. So these components of fitness we're going to assess are body composition, we're going to do cardiorespiratory endurance, muscle strength and endurance, and then also flexibility. These are evidence-based protocols that we're going to be following through CSEP. And evidence-based protocols means that they've been informed and reviewed by relevant physical activity and fitness literature. So they are scholarly, and you can use them across a variety of population groups and ages. As well, these are validated, so they're meeting certain criteria, which is important, especially when we talk about the psychology questionnaires and the physical activity behavior questionnaires. While we assess our clients, we're going to be using, again, the CSEP trainer packages, which allows us to assess their physical activity levels, fitness and lifestyle components. And it's also going to help us collect a health benefits rating for our client using objective and standardized evidence-based tools. So these are a list of the questionnaires we're going to be using and the measurements we're going to be taking. So although we have more measurements listed in the package, for the purposes of this course, we're only going to be looking at body composition using height, weight, and waist circumference. We're going to assess their aerobic fitness using the 1 mile walk test. And in future courses, like in third year XPhys, you'll probably be doing the MCAF step test. So this is a good introduction for another evaluation. But for musculoskeletal fitness, we're going to be assessing the push-up and the one-legged stance. And then we're going to use the outcomes and the scores of these tests to reference the health benefits rating to create a score for our clients. And all of these things we're going to be doing during our lab and assignments. Once we have collected the data and we've assessed our clients, we are now going to advise our clients by creating an evaluation report and having a discussion about our findings with our clients. So when we do this, we're going to show our client the assessment findings, and we're going to discuss the client's priorities for their active lifestyle and help to create a program that provides support for the client. So in order to do this, we're going to use the inventory of lifestyles needs and activity preferences tool to gather some more information on the client. And then we're also going to use what we've learned from motivational interviewing to really collect the information from the client so that they can now essentially drive how we plan their program design for them. So we want them to essentially have the first and final say, and we're just fine tuning the goals for them. And the way we're doing this is by using SMART goals to develop a tailored physical activity and exercise plan. So we want to acknowledge their barriers to physical activity and any limitations that they may have. And we want to be mindful of these when we're creating the goals for them. So once we've collected this information, once we have discussed what our client prefers to do for physical activity and any limitations that they have, we are now going to write up and draft up a SMART goals worksheet that is then going to be reviewed by the client. So final step number 5 is we are going to continue to support the client and check in with them to meet in order to help them meet their goals regularly. So this could be a weekly meeting, which is usually the best means of ensuring that the person's staying on track. So just checking in for 5 or 10 minutes every week, asking them how their goals went, asking them if there's anything that they need from you, asking them if they were able to, do the things that they had planned to do and that you guys had agreed upon in their action plan. And if not, looking at the action plan and maybe assessing or modifying as needed, but always basically checking in to have that foundation of continued support so that they're not just given the program and then essentially feeling like they're abandoned and that they can't reach out. So this step is really, really important because if there's any life changes that the client experiences in the course or over a week period of time, they can let you know immediately. And again, you guys can adapt or modify the program as needed.